citizens of our respective nations and as members of a globalized world. A large part of this impact has been economic. The COVID-19 pandemic has at times brought the world economy close to standstill, which with individuals, organizations, and nations often suffering quite dramatic economic effects. One immediate challenge has been providing high-level health care at a time when national revenues are down and stress on hospital systems has been at record highs. Almost without exception, healthcare organizations across the world have been forced to face unprecedented medical, ethical, and social challenges. The scientific and medical communities have responded with the rapid deployment of their resources in the fight against COVID-19, with healthcare providers, ethical committees, and public health organizations led by the WHO working overtime to ensure safe, effective, and equitable access to vaccines, diagnostics, and therapeutic measures. Today, webinars sees Oman National Committee for Bioethics collaborating with UNESCO to explore a topic at the heart of these efforts: COVID-19 vaccine, a solution or a problem. During the webinar, our speakers will examine the role of trust in vaccine interventions during this pandemic, a public health emergency, in addition to ethical consideration in vaccine development, distribution, and deployment. These very important ethical issues will be further explored in the panel discussion and QA sessions, where His Excellency Oman Minister of Health will start by providing an overview of the role of the Sultanate's government has played in combating COVID-19, including its preparation for a potential vaccine. I wish you all an informative and productive webinar. Assalamu alaikum wa rahmatullah.
Thank you very much, Your Highness Sayyid Dr. Fahd Al-Said, for the introductory and welcome address. You have stressed on very important point: safe and equitable. This is a vaccine that we all are looking for, inshallah. I was just told by the team that there are 746 people registered for the webinar, and I hope that it will initiate a lot of questions and discussions as well. So I will just pass to the first speaker. The first speaker is Dr. Andreas Reis. He's the co-lead of the Health Ethics and Governance Unit in the Research for Health Department of the Division of the Chief Scientist at WHO in Geneva, Switzerland. Dr. Reis' main interest is public health ethics with a focus on infection diseases and outbreaks of emerging pathogens. He's also, one of his great interests are artificial intelligence as well. He published widely and he co-edited 3 books on bioethics and public health ethics. He's serving on the editorial board of Public Health Ethics and Manush Bioethics Review. The topic that he will be presenting will be ethical consideration in vaccine development. Dr. Reis, the forum is yours.
Share my screen. Okay. His Highness Dr. Fahd Al-Said, His Excellency Dr. Ahmed Al-Saidi, Minister of Health, dear participants, good evening and Masa al-Khair to everyone. It is a great pleasure to be with you tonight, and I first want to say a special thanks to the organizers of the Oman National Bioethics Committee for inviting me and WHO to this very important and well-attended meeting. I had the great pleasure of participating in the EMRO Regional Bioethics Summit that the Oman National Bioethics Committee organized a few years ago. And I was very impressed by the beautiful country and the warm-hearted people of Oman. So I regret I cannot be there in person this time, but I'm very pleased that at least we can have a virtual meeting and a virtual discussion. The topic of my talk today is on ethics in vaccine research and development. But before I get to this, allow me in a few minutes just to outline and summarize some of the activities of WHO on ethics and COVID more generally. And this will lead nicely into the topic of vaccines. So in February 2020 already, WHO established a working group on ethics and COVID-19 with the following objectives. One, to provide and develop guidance to member states on ethics and COVID. Second, to identify principles for research and their application. Third, to develop allocation principles for clinical management, vaccines, diagnostics and therapeutics, and finally to prepare for the second wave and provide ethical considerations for that. Here you can see the membership, which is very diverse, of this expert working group. From the EMRO region, we have Dr. Talia Arabi from Lebanon and Asim Ahmad from Pakistan. And there have also been numerous other experts on diverse subgroups. Just want to mention, for example, Dr. Ehsan Shamsi, who I saw is also on the webinar. This working group has developed a number of specific guidance documents for COVID, but it did not start from a blank sheet. WHO had already been working for over 15 years on ethics of pandemic outbreaks, especially during SARS and pandemic flu, but also Ebola in 2014. And this had resulted in 2016 already in a very widely used WHO guidance document for ethics and infectious disease outbreaks. And I won't go into details, but really a very broad framework laying out all the ethical issues that arise in outbreaks. Now, the Ethics in COVID Working Group was very productive in developing further specific guidance for COVID. So one very important area was the ethics of research. And what the group developed was ethical standards for research during public health emergencies, guidance for research ethics committees for the rapid review of research, key criteria for the acceptability of human challenge studies, and then finally, emergency standard operating procedures for research ethics committees that I will go more into detail later. In terms of the pandemic response, so not the research, but the response side, there have been 2 documents so far produced. One is on resource allocation and priority setting, a very important topic also on the agenda today. And the other one on a very important topic, at least in some countries, I don't know about Oman, but the use of digital proximity tracing or tracking applications on mobile phones for the COVID-19 contact tracing, which raises quite a number of interesting ethical issues as well. This is so far the background on WHO's wider activities on ethics and COVID. Let me please come to the topic of discussion today. So we are in a very special context, as you all know and daily experience. In normal times, there's a lack of research funding for many infectious diseases. including infectious diseases that have epidemic potential. This is why WHO and its partners a few years ago, after Ebola 2014, established the WHO Research and Development Blueprint. And its main goal is to catalyze research on priority pathogens that have pandemic potential and for which there is often no vaccines or therapeutics, such as at the time Ebola, Lassa, MERS-CoV, and so forth. So WHO a number of years ago already saw the need to establish this very special mechanism to get more funding for these often neglected diseases for which there's no treatment and or vaccines, and they have a pandemic potential. Now, for COVID-19, as we all know, there has been a huge impact on the pandemic, not only on health, but also on economies and societies. And this has really been unprecedented, I would say, in the last decades, if not the whole century. And in this situation, there's obviously a desperate need for vaccines and therapeutics. And often vaccines are seen as the silver bullet to control the pandemic, to get out of this difficult situation with economic restrictions, travel restrictions, and so forth. This has led to unprecedented efforts and investments to produce a vaccine, investments which are several billions. As of the 9th of September, you can see on the R&D Blueprint website of WHO, there are about 145 vaccines in the preclinical evaluation and around 35 already in the clinical evaluation phase. Now, many people will say, in this situation of outbreaks, we don't have time for ethics. We need to move on, we need to move quickly, we need to find quick solutions, therapies, vaccines. We need to be quick and not necessarily respect the ethics principles. Now, this is not correct. I want to stress that as in the non-pandemic situations, it is really essential to ensure that clinical trials are scientifically valid and are in line with international ethical guidelines. And I think it is even more so because in these outbreak situations like the one now in the pandemic, actually it is always the number one on the headline in the newspapers. And it is very important that the public is convinced that everything is done properly and that ethics is followed. And I think one of my colleagues later will speak about the importance of trust in the public, which is really key. And this is also why we have to adhere to the highest ethical standards, especially during outbreaks. And all actors in research, not only the researchers, but also the institutions, the research ethics committees, of course, the national regulator, and the commercial sponsors have an obligation to ensure that these principles, these ethical principles, are upheld during a pandemic such as COVID. And here you see the key principles that WHO has put forward. So the research has to have scientific validity and social value. There should be a collaborative partnership between different countries. The risk-benefit balance has to be reasonable. There should be a fair and voluntary participation. An independent review of ethics is very important. And then finally, there has to be equal moral respect for participants and affected communities. Now, I won't be able to go through all of these principles in the brevity of time. We can come back to this in the discussion maybe, but I just want to pick out two. So one is the independent ethics review. And again, what we have seen over the past decades is that every time there's an outbreak situation, people seem to see a problem with ethics review. And it's because often the normal research ethics review takes several weeks or months to approve a protocol. And it is true that in an outbreak situation, we don't have that time. So during epidemics and pandemics such as COVID-19, this process needs to speed up. The same ethics principles have to be followed, but the process needs to be quicker. This is why WHO for a number of years has stressed very much that so-called ethics preparedness is really a key component, an integral part of pandemic preparedness. We need to prepare the ethics review committees to be able to work quicker. And this is also why coming out of the Lassa epidemic, for example, in Western Africa, and Ebola, and now again COVID, WHO has developed standard operating procedures for rapid review. And they're called the emergency standard operating procedures, which I want to briefly mention. So the key concerns there are the time sensitivity, but also that there's no compromise on the quality of the review. And what is very important is, oh, sorry, I'm going back. Yeah, sorry for that. Is that the participants are protected in the clinical trials. These standard operating procedures, and you can find all of this on our website, should be implemented only on the declaration of an emergency. There is a checklist of items that have to be rapidly submitted, because often enough, actually the researchers themselves are also not quick enough to submit the necessary materials fully to the ethics committees. There should be an agreed process communicated to the stakeholders and especially to the researchers. And there needs to be a special mechanism to ensure systems, to ensure a search capacity and dedicated people on the committee that commit to turning around these documents, these study proposals very quickly. And again, the principles shouldn't be compromised, but there's a strong need to fast track ethics review in these pandemic times. The second topic I want to briefly speak on, because I think this was of concern also to the organizers, was the fair and voluntary participation and the ethical aspects of vaccine research with vulnerable groups. The first principle to respect here is that participants should be treated with equal respect, and they should be selected in such a way that they are protected and that their risks are minimized, but the research should not systematically exclude vulnerable populations. Vulnerable groups should be included in vaccine trials as far as possible. Now, this sounds all very good, but actually traditionally, pregnant women, minorities, and children have often been routinely excluded from clinical trials, which has often resulted in the fact that there were no vaccines or therapeutics licensed for the use in pregnant women and children. And in the last couple of years, there has been a paradigm shift in the bioethics world, demanding that these vulnerable groups should not be routinely excluded that there should be only exclusion if there are real medical justifications for that. And of course, some of the minorities or other vulnerable groups will need special protections. And this is something the Research Ethics Committee should really look at when research with vulnerable populations is carried out, that they are really receiving adequate protections at the same time. With that, I think I'm at the end of my time, and I look forward to your questions later. Thank you very much.
Thank you very much, Dr. Rice, for a very elaborate presentation. You have covered very important aspects: scientific validity, social values, collaboration, risk and benefits, and also you focused on an important element, which is minority and pregnant women, which tend to be exempted from researches. I will go and move to the second speaker. Our second speaker is Professor Laura Palazzani. Professor Laura Palazzani is a professor of philosophy and law at the Faculty of Law in Lumsa University in Italy. She's the vice president of the Italian Bioethics Committee at the Presidency of the Council of Ministers. She's a member of European Group on Ethics in Science and New Technologies at the European Commission. She's also in Italy's official delegate to the Committee on Bioethics, Council of Europe, and she is member of the UNESCO International Bioethics Committee. Prof. Laura will be speaking about ethical consideration in vaccine distribution. The forum is yours, Prof. Palazzani.
Okay. Thank you very much for the invitation to this very important meeting. His Highness, Excellencies, dear participants, dear President, really thank you for this invitation. The topic is about distribution. And of course, we talk about distribution only when we have scarce resources. In an ideal situation with sufficient available resources for all, we have no problem of distribution. But we know with pandemic, a lot of time we find ourselves with scarce resources. COVID-19 makes the existence of the problem of distribution very evident and very dramatic and urgent. Think about the discussion all over the world about the distribution of access in intensive care, of ventilators, and so on. And so we are expecting the same discussion also with the distribution of vaccines. Every time we have no resources for all, or at least no resources for all simultaneously, we need to make choices. Who does receive the treatment or the vaccine? Who gets it first, for example? Every time we have a choice, we need to refer to ethics. And we cannot allow any arbitrary choices. We need ethically justified choices when we deal with distribution, allocation of resources on a macro level, for example, health policies, or on a micro level, when we have selection of patients. And the vaccine, we know it's still a speculative question because we have a lot of trials, but we have no, at least yet, safe and effective vaccines. But we need to anticipate this discussion on an ethical point of view. So the real problem is that we have not one ethics, we have a lot of ethics. We live in a pluralistic world. And so we have different ways to answer to the problem of choices when we deal with distribution. So we have the libertarianism theory, which is a sort of individualistic framework, putting at the center the maximum market. So, I mean, the free market, the competition, and also the self-determination. So according to this paradigm, when we deal with distribution of resources, generally there's no basis for justification of the obligation of society to help the needy, the vulnerable, because everything is in the free market and left to the ability to pay of the patients. In the utilitarian approach, we have a very different ethical approach, and at the center we have the so-called collective convenience. It means the result of the maximization of pleasure, minimization of sufferance and costs for the greatest number of people. So at the center of the evaluation is the quality of life. It means the number of years to live in good quality. So if we apply these criteria in the distribution, generally, we find out that we may have discrimination of old people, of disabled people, because they cannot fit the parameter of equality of life. That's why we have another theory, that's the egalitarian theory, that put at the center not the self-determination, not the quality of life, but justice as equality and difference. The meaning of equality is the equal consideration and respect of each human being as having an intrinsic dignity. And different means that every time we have a vulnerability, a fragility, a disadvantage, society has an obligation to compensate for that. That's why I may say that in the egalitarianism is really the ethics compatible with the human rights framework. In the human rights framework, we all know there's the fundamental right to healthcare. That's why the egalitarian approach applied to this discussion on vaccines and the distribution of vaccines and the ethical criteria for distribution of vaccines, the egalitarian approach says that we need access for all. So it means on a global level, it means inclusivity. No one should be left behind. Everyone needs to have an equal access to vaccine. It means affordable access for all. It means no monopoly, no logic of power, no logic of privilege, but only access for all. And secondly, justice and equity. It means we need to give equal access to everyone and to adapt the principle of justice according to the concrete need of the populations, of groups of people, and then responsibility and solidarity. No freedom, but responsibility. We are responsible, above all, to assist people that are in condition of particular vulnerability. We all know there are a lot of initiatives on a global level on these topics. I want just to mention the People's Vaccine, an open letter in May 2020 that was on vaccine available to all in all countries, free of charges, and of course many other initiatives of WHO, above all COVAX, that is a very important initiative. And there are a lot of international bodies that discuss on ethics, and I completely agree with the previous speaker, Dr. Andreas Reis, saying that we need time to discuss ethics, even if, of course, in pandemic, everything is in a hurry. But we have a lot of discussion in the Department of Ethics in WHO, but also in a lot of ethical committees, as IBC, International Bioethics Committee in UNESCO, and in many regional and national ethical committees, and in your committee in Oman. What's the specific of this discussion of ethics? It's a discussion that is pluralistic. We have the confrontation of very different theories, and interdisciplinary. We have experts from different fields, medical, scientific, human social sciences, lawyers, policymakers, and we need to find common ethical principles in order to advise regulation. And the second role of these international bodies is also to inform and engage society. That's why I want to mention a statement we wrote in IBC, International Bioethics Committee of UNESCO, that exactly in the time of lockdown, statement on COVID-19, ethical considerations from global perspective. And I want just to quote some propositions that is exactly on these topics. The allocation of resources on a strong public health system is of paramount importance in government's agenda, and we need international coordination. So it's a call to international coordination. Macro and micro allocation of healthcare resources are justified only if they are based on the principle of justice, beneficence, equity as the main ethical principles. And then we recall the human rights framework, as I mentioned previously, and above all, the Universal Declaration on Bioethics and Human Rights of UNESCO in 2005, where we stated that, the document states that every human being has the right to achieve the high standard of health. And above all, a specific attention is given to the vulnerable individuals, because in time of pandemics, they become even more vulnerable because of the possible discriminations of gender, illness, loss of autonomy, age, disability, ethnicity, and so on. So the call of the statement is to pay attention on responsibilities towards vulnerable individuals, and above all, to avoid any form of stigmatization and discrimination. At this time, says the statement of IBC, when most societies are ruled by economical power and competition, we need to remember that we need cooperation, not competition, but cooperation. In time of pandemic, cooperation is at the center. Cooperation needs between governments in the public and private sectors, within civil society, between international and regional organizations. And so IBC and COMEST is the other committee for the World Committee of Knowledge of Ethics in Science and New Technologies. And we call for international cooperation that goes beyond the national interest of specific territories. That's why, which concrete actions on a global level for vaccines? This call of egalitarian approach is against the so-called vaccines nationalism, as a sort of predatory rush in terms of power, political and economic, in order to have a lot of quantities of vaccine before and to distribute only inside the nation. It's very unfair on a global level. The other way to get out of this problem is to recognize from the national governments a sort of cross-border responsibility towards the other, particularly in times of pandemia. That's why there is a sort of theory of the so-called national partiality. That is, each nation produces vaccine for its own citizens, but need to keep and recognize its responsibility towards other countries and other vulnerable population. That's the idea of a private-public partnership and the so-called cross-border responsibility and solidarity. So the values at stake are the values of beneficence, non-maleficence, as the main values. We in the distribution, we need to try to benefit people, limiting harm, equally considering every human being as similar to every other, avoiding any form of discrimination, and prioritizing the vulnerable. Maybe we can also discuss it during the panel discussion. For example, there's a lot of discussion about, for example, prioritizing healthcare workers or people working in essential services, old people with comorbidities or chronic disease that have a specific condition of vulnerability. So what are the lessons learned in pandemia? Maybe we cannot use the past because we are still in pandemia, but the point is that pandemia teaches us that we are related. Relatedness of everyone to all. There's no borders in pandemia, and so there should be no border also in bioethics and biolaw. We also need global ethics and global regulation, global public cooperation beyond private competition. And this is a very important principle for IBC, benefit sharing. So the sharing of knowledge, of data, of technologies, of results, but that's the only way to cooperate in order to achieve together the main result, that is vaccines and getting out together from pandemia. And this is the main core issue of a global bioethics and biolaw in times of pandemia in order to go beyond pluralism and territorialism. Thank you very much for your attention.
Thank you very much. Now we will move to our third speaker. So Dr. Zahid Al-Mandari. Dr. Zahid is a radiation oncologist and a member of the National Bioethics Committee. He headed the Bioethics Committee in Royal Hospital, where during his tenure, he introduced unique approach to evaluation of the different bioethical dilemmas. Dr. Zahid will be speaking about the ethical consideration in vaccine deployment. Dr. Zahid, the floor is yours.
Thank you very much. So I'm going to start my talk on some very controversial issue, which is the ethics of vaccine deployment. I'm going to touch on autonomy. I'm going to talk about anti-vaxxers, mass vaccine policy. I'll touch also on vulnerable groups, and I'll have some recommendation and action points. So I'll start right from the beginning. Basically, we know vaccines work. If we put into consideration that vaccines have been around for more than 200 years, well, you know that millions of lives have been saved. And the only diseases we've actually been able to eradicate are those that we have been able to vaccinate, and that's smallpox and polio, which is just about to be eradicated. So you look at this graph where there's a comparison of the annual morbidity in the 20th century versus 2016. You can see that vaccines have made a huge impact. But with all this data, why is the movement of anti-vaxxers increasing? Anti-vaxxers are basically the movement of people who are against vaccines. So
please put slideshow. Your slide is not shown.
Oh, okay. Sorry. Is that okay?
Not yet. Share screen.
Okay, 1 minute. Share screen. Okay. So if we look at this graph, my slide is seen right now? Yeah. So if we look at this graph, basically you see that in the 20th century versus 2016, vaccines work. But the anti-vaxxers momentum is still gaining movement. A study that was done in 2016, where 67 countries were surveyed, titled "The State of Vaccine Confidence," showed that 5.8 of the respondents globally were skeptical about the importance of vaccines. And in some countries, that was as high as 15. And that was in 2016. We know that between 2016 and 2020, this movement has gained even more momentum. So with all this data, and that's there, why does the anti-vaxxer still have good momentum? Well, the first point is that the reasoning behind why the diseases have gone down is they say that, well, hygiene has improved, nutrition has improved. That's why the infections have gone down. So that's a good point. But given that because of this movement of decreased vaccination, we're now starting to see a resurgence of disease where we still have good vaccination and still have good diet. So that sort of counters that notion. But then the biggest notion is basically the risk-benefit ratio. And one of the biggest concerns for the anti-vaxxer movement is that vaccines can cause autism. And there are three major theories behind this, but there are multiple studies that show no correlation. But not just the studies, there is independent reviews of those studies that also show that there is no correlation. But what's happening is that to translate that into influencing skeptics has become a huge issue. And the reason is this. Basically, we start to see that there is mistrust, and the mistrust is mainly in big pharma. We know as doctors that the pharmaceuticals always do this, where the distribution is limited to certain countries and so on for certain drugs, especially now with things like remdesivir, where certain countries have actually bought huge amounts of this drug and hoarded. And so this is more towards the protection of distribution rights and to make sure that these medications reach the group that they're intended to. But on the flip side, you get a message saying, wake up, Africa, this is not a cure, it's a trap that can kill you and use you as a laboratory rat. And this is where, you know, the social media is starting to play an important role and building mistrust and disinformation. And most of these viral messages have a certain recipe where they bring certain truths into the picture and they mix those truths with false information. And it's normal for a human being to look and see, okay, I can buy remdesivir, I can see that it has this tag here that says not for distribution in certain countries. So if this is true and the logo is true, then probably what they're saying about using us as lab rats is also true, which is what the recipe for disinformation is always. You'll find that many of the viral messages have disinformation as well as some truths. It's not always lies. If it's all lies, it's usually discarded from the beginning. So, and even if we look at the economical impact of vaccines, we know that there's a nice study actually that was done that looked at 94 countries of low and middle income countries, and that estimated that they paid around 34 billion for immunization programs, but resulted in 586 billion in reduced cost of illness and 1.53 trillion in broader economical benefits. So really, vaccines do help. So now the question is, where does autonomy fit? Obviously, everyone has a right to make a choice. But when vaccines not only provide individual protection for the persons who are vaccinated, but they also provide community protection by reducing the spread of disease within a population, that becomes a big question. Here you see in group A, where there are people who are vaccinated, but the vaccination rate is low, but and the transmission of disease does happen. When you compare that with group B, where the vaccination rate is much higher and the disease transmission is interrupted. So you just have to think about that. So let us just take an analogy of a boat where you have people which is sailing on fresh water, and you have lower deck passengers and upper deck passengers. The lower deck passengers, when they want water, they have to go to the upper deck. And if the lower deck passengers say, you know what, let's just make holes in the lower deck and see, and we'll get water, we're not going to harm any of the upper deck passengers. If we let that happen, then the ship will sink, and the people who are on the upper deck, even though they were not involved in creating that hole, will also sink, and they will not reach the destination. So that's a very, very important analogy when it comes to when community well-being is at stake. Where does personal choice fall? So that's where we sort of start to talk about the social media and the role of disinformation. And what I've seen now with Twitter and Facebook is that they're actually starting to censor disinformation. And that's where this sort of role of oversight on what is true and what is not. Obviously, there's a debate as to who has the right to decide what's best for the whole community versus someone else. So that debate is obviously there. But it's the same analogy as the boat, where someone has to stop someone attempting to put a hole in the boat, or the whole boat will sink. So can we afford to force vaccination? Obviously, if we can't, what are the alternatives? And alternatives, there are many. Some are also controversial, while others are less controversial. So nudge is a technique that has been used, and basically you basically guide people in order to take the vaccines, and that's by using things like fines, limiting services. For example, travel. You wouldn't be able to travel if you're not vaccinated, or you wouldn't be able to go to school if you're not vaccinated, or charging for treatment. For example, if you opt out of a vaccination and you get sick with that particular disease, then you'll have to pay for treatment. Otherwise, if you don't have to pay for treatment. Or reverse consent, where everybody has consented except those who fill a form and go and basically state that they don't want the vaccine. So this is kind of it's very controversial, and talking about nudge ethics is beyond the 15 minutes of this talk. But what's better than nudge, obviously, is campaigning. And just like how for disinformation is becoming widespread, we really need to have a campaign talking about what is the good, what is the bad, what is the ugly of the vaccines. And I have to talk, when you talk openly and you're transparent, that's when you start to gain a trust. And transparency is really the key here. And you have the Oxford vaccine that basically stopped. It's one of the major vaccines that had huge hopes with countries that have actually started pre-production to basically prepare for deployment. And you can see that they stopped the study basically because they want to evaluate something that has happened to one of the participants. So this type of transparency is required in order to start to gain trust with the public. So when it comes to the deployment, assuming that we've had very good campaigns and everyone wants to be vaccinated, supply is not going to cover demand anytime soon. And we know that, and that's a fact. So who is eligible and who can be vaccinated first? Dr. Laura or Professor Laura has covered this briefly, talking about the frontline workers and high-risk individual, basically those with the highest exposure or the highest risk of dying will be the first, and then that basically goes down level by level as the phases go. So I'm going to share with you an example of a policy that was deployed by the National Academy of Medicine Committee of Equitable Allocation of COVID vaccine. This is in the US, and basically they chose a similar approach with phase 1 frontline workers. Makes sense. All the adults living in crowded, congregated settings, again, makes sense. People with significant illness at high risk of illness and death. So that was phase 1. Then phase 2 goes towards more of the essential workers who cannot do telework or working from far. Things like teachers or schools that are not going to be teaching or teleschooling. People with illness at moderate risk and so on. So basically the level of phase 2 goes down. Then level 3 is more of an economical recovery, looking at vital workers in occupations with moderate and low risk, basically who, if they go back to work, then the economy is very likely to go towards the recovery phase, young adults and children. And then finally, phase 4 is for more of the individuals interested in receiving personal protection. But again, they say here personal protection when we know that it's not just personal protection, it also provides protection to the community. So there are things that we need to look at when you look at this deployment. And I'm not saying this to be critical, but although from the same report, they did mention that people of color have been disproportionately sickened with COVID-19, but the report did not recommend listing Black, Hispanic, or Native Americans as distinct priority groups, which kind of, we talked about some of the priorities and vulnerable groups, and maybe you need to rethink of that. If you're a country preparing a policy for vaccination, you should be looking at the vulnerable groups. So that's one thing to look at. But then we also have to look at the safety of vaccine in elderly and children. That's an important topic. And that was covered a bit on the first talk, basically with the children and pregnant women. But in the studies that have looked at vaccination, most of them and have been in the age group of 18 to 60. And we know as you go above 60, the risk of dying from the disease is much higher. Although some studies did open the door for studies above 60, they did have stringent criteria, meaning there's no comorbid disease, et cetera, which kind of limits the number of people who can go into those groups. So we need to be extra careful interpreting the data when it comes to the elderly and children. So this brings me down to the final recommendation. So really, what we need to do is first, we need to curb disinformation campaigns. And we also need to have our own early campaigns. I know vaccine is far away, but we need to start that very soon and we need to be very clear about the benefits of vaccine versus the risk. We need to be fully transparent about the good, the bad, and the ugly of the vaccines. And I thank again Oxford, the vaccine group, for being transparent and stopping the study. And we need to also to continue to share data while vaccines are happening. Saying, for example, that 10% of the population has been vaccinated, so far no side effects, etc. Or we had minor side effects of fever, etc. These are things that the public need to know. And that basically builds the trust. And finally, we need to develop clear guidelines of who is to get vaccinated and to take into consideration minorities and vulnerable groups and be cautious about the vaccines that haven't been tested on the very young, the very old, or the pregnant, and keep an eye on data that's emerging from this particular group. Thank you.
Thank you very much, Dr. Zahid, for a very elaborative, comprehensive coverage. And now I will move to the final presentation. Our last speaker is Sheikh Dr. Kahlan Al-Kharousi. He is the Assistant to Grand Mufti of Oman since 2010. He completed a master's degree and a PhD in Islamic Studies from University of Oxford. He is the Vice President of the National Committee of Bioethics and President of of the High Sharia Committee for Islamic Banks in Oman. He's also a member of many committees and societies. He has authored many publications in English and Arabic on Islamic thoughts and religion. Sheikh Dr. Kahlan will be speaking about the role of trust in vaccine interventions during public health emergency, a continuation of the points that were raised in Dr. Zahid Zemender's talk. Dr. Sheikh Kahlan, the forum is yours.
Thank you very much, Dr. Faryad. Bismillah ar-Rahman ar-Rahim. All praise be to Allah, peace and blessings be upon His last messenger. Thank you very much, Your Highness and Your Excellency, all our participants. It gives me a great honor to participate in this webinar, our 9th forum for the Omani National Bioethics Committee. I would just ask our organizers to share my slideshow as I am facing some problems sharing it from my iPad. If it is possible, I emailed it to Dr. Zahid, Dr. Ahmed Khitami, and I think Dr. Ahmed Al-Busaidi. Would it be possible, please, just to share my slideshow?
إن شاء الله فضل الدكتور دقيقة بس.
Okay, I'm supposed to talk on the role of trust in vaccine interventions during public health emergencies. My outline here, and being the last speaker, this has saved me a lot of information and of time. So it's going to be like a dessert for this rich and profound meeting tonight. So I'm going to talk on some of the introductory facts that I'm going to base my consequences, my results on. What are the threats to trust? If we all agree that trust is a major element for vaccines and to distribute vaccines, then what are the threats and challenges? I'll try also to give some ideas and thoughts on how to bridge the confidence gap that is already available. I will conclude with some recommendations. I'll try not to repeat what my colleagues have already said. So for the introductory facts, let me, as I said, start from the introductory facts. We all agree that vaccines save millions of lives all around the world every year. And this is an agreed about fact. The acceptance of routine immunization worldwide is relatively high. It is the next slide, please. So the acceptance of routine immunization worldwide is witnessed to be relatively good, or actually even high. It is more than 83% to 89% in some advanced countries. Trust in vaccine and in health systems is the most important element of any public health program. And this is also agreed about. I don't want to establish an argument just to support this idea, because it is well known. Whenever there is trust and credibility between the recipients of vaccines and the health system and the vaccine, then the setting altogether is going to work and achieve the goals. But at the same time, there are threats, and these threats of a global nature, they are very similar. I'm going just to pin out some of them, but being, for these threats being of global nature, actually is a positive thing, because dealing with these threats and challenges at a globalized efforts is going to be much easier than every single nation by itself facing and trying to tackle these threats and challenges. But anyhow, as Dr. Zahid had just said, that still those anti-vaxxers are still available. They are gaining momentum, and no doubt that social media and the advanced technology of communication that we have, all the platforms that we have, all of these have made their goals easier. And the last fact here that I want to elaborate on is that any plan aiming to deliver a life-saving vaccine must be inclusive of all scientific, ethical, religious, cultural, political, traditional settings. It cannot exclude any of these elements in order for it to be influential, in order for it to be able to reach the people and reach the public and achieve the goals planned for. Then all of these elements must be included. Having said that, now let's identify the threats. Misinformation, and I think we, through the last three presentations, we have been exposed to many of misleading information or misinformation. At the same time, one of the major threats is also lack of awareness. Sometimes information are there, but the attitude of the public towards this information are very minimum. So there is a lack of awareness. Or it could be due to poor health service or wrong approach to the public. The main threat has not been tackled, and accordingly, the approach is wrong, so no goals are to be achieved. Beside also the socio-political circumstances of a certain society or nation that might not be under consideration, and consequently, they might have a negative attitude towards a particular vaccine. Now, the second, the spread of myths is a major threat, and this includes rumors, stigma, conspiracy theories, all what you might think of. And actually, there are some good studies on this issue that WHO has called myths, including rumors, stigma, conspiracy theories, showing that it is worldwide. It is a phenomena worldwide. Many people are negatively affected with these rumors. And in order to be able to plan strategies that would achieve their aims, this must be put under consideration as a challenge to be dealt with, to be given right solutions. Otherwise, it's going to be a difficult task for those who are supportive of vaccines. And of course, this would lead us to the main threat that sometimes policymakers are lacking plans and strategies with clear goals, with the means by which they can achieve their goals, and they utilize of the resources that are available in hand. Now, if we have identified the threats, and the last one was to be able to establish a strategy or a sound plan, then we must focus on constructing a trust between the public and the vaccine, between the public and the health system. In order to do this, then we have to identify the threats, utilize the resources that we have, and plan a strategy. And I do fully support the idea of planning this in advance. We are about to receive vaccines, so let us at this moment plan for the distribution, the deployment, and how to tackle any threats and challenges that might prevent the accessibility of vaccines by the public. And the key issue here for constructing the trust and bridging the confidence gap is to provide information. Under the condition that this information to be authentic, so they have to be evidence-based, reliable, credible, transparent, and at the same time accessible. So the public would have access to this reliable, authentic, credible data in order to increase their awareness, and at the same time make them confidence that confidence in the health system and in the vaccines. This, of course, I mean the information that should be available with the authenticity and the credibility and transparency should lead us to utilize them with the right approach. I still remember last year when I participated in a forum held here in Muscat by WHO, IMRO, with the Ministry of Health, for a group of policymakers and influential tribal and religious leaders who participated here from Pakistan and Afghanistan for the campaign for polio vaccine. And it was a very good step taken here in Muscat by WHO. I was one of the speakers, and I still remember that with the scientific data that I presented, none of the audience was taking any notes until the moment that I quoted verses from the Quran, some prophetic traditions, and started analyzing this evidence from Quran and prophetic traditions. It was only then that they smiled and they started taking notes, and afterwards we took selfies. So the right approach with the right people is crucial here. It is not only a question of information and the authenticity and the ethics of the information, but it is the right approach that is also necessary. And of course, no one would argue against the importance of cooperation global-wide and between organizations and institutions concerned. Now, my final slide is just a summary, a brief summary of what I have been talking in order to gain trust that would make it easy for practitioners and for policymakers and for all organizations concerned to achieve their goals. It is very important to empower those who are in the ground, practitioners, religious leaders, tribal leaders, with all the concerns of the people, with all the sensibilities that they may face, people have and are going to raise. how to tackle them, how to handle them. Second, it is also very important to utilize modern media platforms. These are the platforms where myths are circulated, and unfortunately widely circulated, and it's not necessarily influential, yet we have to use these platforms. We have to use social media, we have to use very powerful narrative in order to change the mindset of those who are still reluctant. And the engagement of all stakeholders is also important, national and international. Information on this regard must be transparent in presenting both risks and benefits, and assuring the public that the vaccine is safe and effective, and build and sustain trust throughout the way. So it is not only to build the trust, but it is also very important to sustain that trust in order for any vaccination program to be successful. Thank you very much.
Thank you very much, Sheikh Dr. Kahlan, for setting the path for constructing trust, because I think you alluded to very important points. And if I summarize them, and there might be also a forum to start the discussion, policymakers need to address ethical issues ahead of time. Community leaders and advocates should take a role and get early engagement. Transparency, vaccine advocacy groups and interaction with them. Media, educational campaign for vaccines ahead of time. Implementing monitoring strategies and surveillance for and ensuring to the public that countries are monitoring the side effects of vaccines, drugs, and then finally, you know, a balance between autonomy of a person and the needs of the societies and other individuals. Thank you for all the speakers. And I think I will start with the first question. I would request Your Excellency, Dr. Ahmed Al-Saidi, are you with us?
Yes, I am. Good evening.
Good evening, Dr. Ahmed. Your Excellency, may I start with the discussion with, we have discussed today many ethical consideration. In your opinion and with your vast experience and management of previous similar pandemics, what is the most ethically challenging issue among the one discussed, and particularly for our region, and also if we focus on Oman?
Firstly, thank you very much to all of you, and for His Royal Highness Sahib Sumo Sayyid Fahad Al Saeed for giving me this opportunity to share some thoughts with you. And I found the previous talks very enriching and very helpful. Can you hear me?
Yes, Your Excellency, can hear you. Yes.
Okay, good. Well, to start with, I think the whole world been struck by this worst pandemic in more than a century. And the cost, human cost, financial cost, social cost is immense. Just to talk in sense of economy, up till now, more than $11 trillion been spent or lost due to this pandemic. Death rate is rising. Hello, hello.
Your Excellency, you
I'm
are
sorry. Yeah, the connection unfortunately was lost. I'm in Salalah and the internet is very poor, so I'm on 4G here. So let's go back to vaccine. And I'm not going to repeat what everybody said, which was excellent talk. But give you an example in Oman, before the Renaissance, before 1970 or early 1970, before we started the vaccine program, 180 kids, children, child used to die before the age of 1. Now that number dropped below, that's per 1,000 live birth. That number now dropped below 9 cases. The main reason for that, of course, is vaccination, in addition to other cofactors, of course. So those who still doubt the effectiveness of vaccines, those that Dr. Zahid mentioned, that the movement against vaccine, which unfortunately actually more widely spread in some very developed countries. I think unfortunately we are not doing much to counteract their rumors, their lies. I'm sorry to say it, but it is lies, and it's spreading worldwide. But I think the effectiveness of vaccine is extremely, well, it's well known and very important to all of us. Let's come now to COVID-19 and talking about vaccine. We are following WHO press conferences, the guidelines, and I think what's needed worldwide is the solidarity between all of us. I think what we need, what Sheikh Gahlan and the rest of the speakers said, the transparency. And I was very glad that AstraZeneca, which is the Oxford Group vaccine, but the company AstraZeneca, they halted the phase 3 clinical trial for 2 days because of one case of a person, one of the participants had an illness which could not be explained. So for those who still have doubts about how serious the companies and the regulators about vaccines, I think that was a very good example. I think one of the problems, unfortunately, facing the world now when it comes to whether to therapeutic, diagnostic, and vaccine, some of the leadership statements coming from certain corners of the world, which are unfortunately, they don't instill confidence in us or in the public. And leadership is extremely important. And we are very glad in Oman. His Majesty Sultan launched the Supreme Committee, which is representing different sectors and taken, hopefully, what we believe are well-studied and balanced decisions. The history of vaccine in Oman is very good, and we are very proud of it. Up till this year, the vaccination rate, which all of you probably in the group, they know that it's more than 98%, to 98 to 99%. There have been some, unfortunately, cases this year where parents didn't come for follow-up vaccination, but we are tracing that and we will work with them. COVID-19 vaccines, as you've mentioned, Dr. Furial and the group, there are more than 160 probably now on, well, companies are working on them, and several on clinical trials, and more than 9, I think, which are in phase 3. And it might, if we are lucky, we might have production before the end of this year. But unless the distribution of these vaccines, start with, we have to all make sure, and that's the role of the scientists, of the companies, to make sure that they are effective and safe. And but when they're effective and safe, unless they are distributed equally or equitably to everybody, they will be useless, because nobody and no country is safe unless and until all of us are safe. We join COVAX with WHO, Oman, with 170 countries. And I was astonished and surprised, actually, that a few of the very rich countries are not part of that alliance. So we are with WHO and many other countries and organizations, we are definitely pushing for equal distribution. We have to put priorities, all of us, because no matter how many companies start producing vaccine, there is no way they can produce enough to cover the 7+ billion people worldwide. Everybody agreed that for frontline healthcare professionals must be given priorities, because without them, we cannot do anything to combat the disease. Not only that, without healthcare professionals, all the other programs that I've mentioned, one of them is vaccination program, will not be working. So for healthcare professionals, and we need to remember also, whether in Oman or in other countries, that side by side with healthcare professionals, they are volunteers. And these volunteers, I think I strongly believe we should consider them as part of the team and give them priorities. Then, of course, other groups which mentioned in previous talks, I will not repeat that. But in Oman, we already have a clear way and guideline how to go about it. It's a matter just of getting the vaccine. And I can assure the public in Oman, assure you all that we are working with all concerned companies. We work with WHO. And hopefully when the vaccine becomes available, we will be getting it, but fairly with other countries. It's not going to be exclusive for Oman. It's not going, hopefully not exclusive to any country. So it's I can't say exciting time. It's a very difficult time. Everybody is getting tired. Everybody is frustrated. And all of us wish that would be over very soon. But again, let me remind the viewer, the vaccine might not be available till the end of the year. When it's available, it won't be available for everybody, but we can still slow the spread of this disease with the tools that we know. Proper use of the mask, hand hygiene, respiratory etiquettes, and of course, keeping the physical distance. I'm not tired or shy of repeating these instructions on every occasion. And I know the cases in Oman started rising again, unfortunately. And we know why. Because people, of course, they are tired, but also, unfortunately, they become more relaxed than what I would like to see. So thank you very much again, and I'll be more than happy to answer any other questions if there are any.
Thank you very much, Your Excellency. You have highlighted and answered actually many of the questions that were raised by the participants. The one important thing that everybody was asking in the group was the equity. Safety is a consideration, and many of the questions were about the safetiness of this vaccine. Also, shared responsibilities, you have alluded to that. The solidarity, and whatever vaccine will be provided is not for individuals, it's for population. It's not for countries, it is for probably more population. So this is, the government already have all the necessary actions that they have planned ahead. That's a good thing to know as well. I will move to the panels, and thank you very much again, Your Excellency. It seems we have lost the connection.
I can see you and hear you.
Okay.
I'll be following you.
Okay, so we will go to our dear panelists and the speakers. I think the first question is in the same path. The question is, what are on everybody's mind at a global level, international level, how we should ensure fair and equitable distribution of the vaccine that is safe and effective based on the needs and the resources once vaccine is available. We had the pandemic of H1N1 and the same solidarity probably was there, the same issues related to the fairness, equitable, but on the real ground, some challenges happened, but that was a long time ago. So, I mean, if I start by asking Dr. Andres Rice, from the point of WHO, what do you think is, I mean, how it will be, how to ensure fair and equitable distribution?
Thank you very much for this key question indeed. And I think His Excellency Dr. Ahmed Al-Saidi has already promoted by WHO, which is really the solidarity and equitable access to vaccines worldwide. And in order to advance this goal, at the end of April already, WHO and its partners established a so-called Access to COVID-19 Tools Accelerator. which brings together governments, scientists, businesses, and civil society, and global health organizations such as CEPI, FIND, Gavi, the Global Fund, and so forth. And all these partners are working together to ensure equitable access to not only vaccines, but also diagnostics and therapeutics as they are becoming available. Just today, we had another very important conference call discussing the allocation of diagnostics. So there's really very high level attention to this question. As His Excellency has said, the COVAX facility has already enlisted more than 170 countries. I think most of the countries, it's fair to say, are really on board with promoting equity and equitable access as the vaccines become hopefully available in the end of this year or beginning of next year. But what is for sure is that even if every country will receive 20% initially, then every country will still have to make priorities within the country who should be receiving these vaccines first. And I think that's why it is very important at the country level to already start discussing and making these priority groups. And again, I think as the previous speaker said about trust, it's very important to include the civil society, the religious leaders, all the important groups in the country to agree on joint priorities that are supported by everyone. And I think seminars like this webinar can also contribute very much along with social media and other forms of meetings to build trust and sustain trust in these measures.
Sure, thank you very much.
Okay.
I'm going to just move to Prof. Palzani. There are several questions regarding the research ethics and whether there are certain countries where the research, you would say rich countries, and they're conducting research, and probably countries with low resources. So what's the kind of ethical background on that? Also, there are questions regarding the ethics in research, and maybe here all the panel could contribute as well. And regarding, I think Dr. Rice alluded to certain fast tracks and how the safety issue is monitored. So if we start first with conducting trials in countries with low income, what is the opinion on that?
Thank you for this question. And research is fundamental in vaccine and as in every kind of new discoveries. But we need to protect the safety of each participant. That's the first point. And of course, we have a lot of pressure all around the world to get a vaccine. But anyway, we need the ethical procedures and the scientific procedure in order to have really a safe vaccine. For example, in Italy, we had a discussion these last days about the possibility not to go beyond the so-called fourth phase of experimentation, because we have a rush. We are in a rush. We want to speed the trial, but we cannot do that because of the safety of participants and because of the safety of the people who will get the vaccines, because vaccines can be safe or not, or unsafe. So now we need to prevent illness, not to provoke illness. That's why we need to observe the scientific procedures that is agreed in the scientific community for trials. On the other hand, we need to share the results. That's very important worldwide. So if we have a result, we need to share it, not to to take for ourselves in a very egoistic and individualistic way. And there are a lot of initiatives in order not to overlap research in different countries, because we have a lot of research and that's something very important, but we need to manage our effort because we need to work together. That's why it's very important also the sharing of benefits all over the world and the transparency in research in order to share results.
Thank you very much. So do we think we have this transparency and sharing information currently with COVID-19 vaccine production or development and
yeah, so I saw in the chat there were a lot of questions about the intellectual property, licensing, patenting, and that's really a very huge question because of course the pandemic shows that these laws on intellectual properties need to be kept, but to be changed in the specific situation of pandemic. And we are discussing a lot about that, not only for COVID-19, but also for, nowadays there are a lot of illnesses where we have therapies, but they are very expensive and they cannot be sustainable by a lot of people. And that is really a huge question. So we need to discuss on a global level the intellectual property. I cannot say that we need to annul intellectual property, because we need intellectual property, we need licensing, but we need to limit it when we have a challenge for global health as pandemic. We need to change something, because otherwise we will improve egoism, individualism, nationalism, and we do not go towards the sharing, as I mentioned before, of benefits.
Okay, thank you very much. So I'm going to Dr. Zahid. In your talk, you presented issues in regard to autonomy. So what if the person, let's say a healthcare worker, these are the groups of that will be given priority if they refuse taking the vaccination, a vaccination that is scientifically safe and effective. Supposedly we reach that vaccine. So what do you think, how we can handle this situation? Refusal of vaccination. I think you mentioned some of the things about the importance of taking that in consideration, but the balancing the ethics versus, I mean, it's me, my need as a healthcare worker, and the others.
That's a very good question. I think the first thing, before we actually reach a situation where we have people who are refusing, we really have to work to make the information available about the vaccine, about how safe it is, or what are the risks and benefits associated with it. That information and campaigning has to happen way before the vaccines arrive. And that's a very important step to sort of minimize. It's going to happen. There are people who are still going to refuse taking a vaccine. Can we force them? I think that the answer to that is no. I think autonomy still is a very important virtue that we need to respect. I think there should be a dialogue. It shouldn't be no, okay, next. It should be a dialogue as to why, what are your concerns, what are the issues that you think are related to this? Can we at least have an opportunity to address your concerns and explain and basically also one of the things that helps when you actually are vaccinating is sharing the vaccination data, saying, oh, 20% of the population has been vaccinated, 25%. So you sort of build up momentum. That's an important step in also sort of achieving an opt-in, saying, oh, so many people are actually opting in, I'm the odd one out, And even when it comes to healthcare workers, if we're targeting phase 1 as healthcare workers, it'll be nice to say, okay, 98% of the healthcare workers have been vaccinated. That alone will also encourage the 2% to say, well, you know, maybe I should opt in. Obviously, you will have a problem if you have 60% of your healthcare workers refusing to take the vaccine. That will be a big problem. But generally speaking, I don't think the problem is that huge. It's a matter of sharing data. It's a matter of campaigning, and it's a matter of addressing concerns, and rather than just being dismissive. Next. So that's how I think we should approach the people who refuse.
Thank you very much, Dr. Zahid. If I might go to Sheikh Dr. Kahlan, you have alluded very nicely to the example in your one of your presentations or talks that you give. Can you elaborate more on the role of religion, particularly in our region, in focusing and helping people to make decisions regarding their health, regarding their moral obligations, especially that we are faced with an anti-vaccine groups that are really very active. A single, I remember an interview back in 2009, one of the channels, and that time there was no good social network, there was no WhatsApp, no Instagrams. That single episode have resulted in reduction of a vaccination, at least in our part of the world, I remember H1N1 vaccination rate was only 40%. That was the intake. So, so how we will focus on the role of religion in helping people to make some of these decisions?
Well, first of all, I have to highlight that the role of religion in such crisis is very crucial, and policymakers should not undermine this role, because if they do so, then, as I said in the presentation, goals are not going to be achieved. And we have seen this in different parts of the world. Wherever there are any orthodox faiths, then they might have a lot of concerns regarding the source of the vaccine, as an example, the taking of a vaccine, the people who are providing and manufacturing the vaccine. And we have seen these accusations, and unless these concerns are tackled and people's questions are met, then they will not accept the vaccine. And here comes the role of religion. Those who do have such, as I said, illusionary, even if they are not factual concerns, they have to be approached in a proper way. And in different parts of the world, still religion is playing a great role. Starting from the preventive precautions that one might take as an individual or as a society, then answering the questions. I have, just as an example, I have gone through the questions that we received, and we have received some of the questions regarding the ingredients of the vaccine. And some people, some of our audience here are saying that they are reluctant. They are not going to take the vaccine because they are not sure about whether these ingredients are halal or not. Now, if I approach such a concern, then I'm going to quote a decision taken by Fiqh Academy upon a consensus, an agreement between all Muslim scholars, saying that whenever there is any necessity and there is no alternative, so even any remedy, any medicine consisting of unlawful, non-halal ingredients is, because of this necessity, is allowed. Now, many people are unfamiliar with this decision taken by scholars, ulama from different schools of thought, and it is a consensus. Why is that? Because it is based upon evidence from the Quran and from prophetic sunnah. Now, for those who might think that the side effects also are greater than the benefit of a vaccine from any religious perspective, then these concerns also must be handled and tackled. Otherwise, still the attitude is going to be very negative, and they might spread such myths, such rumors within their own societies. And as His Excellency has frankly put it, unless we are all immune, then we are not going to achieve any goals. So I don't want just to give a lot of details regarding this, but religion plays a great role and it has to be under consideration. It should not be undermined when tackling such a crisis, from the protective procedures required to the ingredients of the vaccines to the concerns people having regarding their rituals and acts of worship before their Lord, then to the deployment of vaccine. All of these are, we will find a lot of arguments regarding religious issues, and I can take just a spectrum of different faiths. They do have the same discussions. Let them be engaged in these discussions, and I have no doubt that those who are thoughtful and open-minded, they are fully supportive of such campaigns. Thank you very much.
Thank you very much, Sheikh Dr. Kahlan. I just will go back to Dr. Rice and Prof. Palzani. Just many of the questions that were addressed to us in the chat, they are around the safety of the vaccine. And one of the key things that the questions are coming around is, how safe is the vaccine? Is anybody monitoring that? What's the role of WHO, other agency, countries in ensuring the safetiness of the vaccine? So being a representative like on the ethical committee on WHO, Dr. Rice, what are the different, and you have been in previous, you work in the previous pandemics as well. So what are the safety steps that countries should take, international organizations should monitor when a vaccine is available or in the development process?
Yeah, thank you very much. That is also a very key question, of course. And as I said in my presentation, there can be no compromises on safety for different reasons. One is, of course, for the health of the participants and the population, but also, as we have heard, for the trust of the population in the vaccine. So this is why it is really key to maintain the safety, because if the vaccine is developed hastily and there later on are great safety concerns, then the vaccine is very, the trust of the population is very hard to gain, but very easily lost. So I think it would be really very dangerous to move forward with the vaccine where the safety is not clearly established for very different reasons. Now, it is usually the job of data monitoring boards to watch over the safety and on any incidents that happen. And Dr. Ahmed already, His Excellency already mentioned the case of AstraZeneca, where a trial was halted to make these investigations. And I think this is exactly what is needed, not only for the ensuring the safety, but also for ensuring and instilling the trust in the populations of the world in accepting the vaccines that are developed and hopefully ready by the end of the year or by the beginning of next year.
One of the probably important, also worth mentioning, that the WHO have a solidarity vaccine trial, which is part of the initiatives also to ensure safety and also equal distribution once these vaccines are have passed to the trial. So that's an initiative, and that's one of the questions as well, like why there is a concentration on vaccines and there is no much concentration on therapeutics, where we know maybe in some of the vaccines the antibody response will be lower than you want to protect you, and the protection time might be short as well. I mean, any comment on that? That was one of the questions also.
Thank you. I saw that question also. I have to say that from WHO's perspective, of course, the therapeutics are equally important. And actually, the first solidarity trial that has already started, organized by WHO, is on therapeutics. And the vaccine solidarity trial is only starting. So in that sense, I think it's sort of a misconception that the vaccines are the only dominating topic. Also, the ACT Accelerator that I just mentioned has these 3 pillars. Next to vaccines, there are the therapeutics, but also the diagnostics are very important, because we still have a situation in many countries where actually there is a lack of diagnostics, and this is very important also to equitably share all the test kits and the diagnostics that we have, and of course the therapeutics once they become available. Over.
Thank you very much. We have a question to His Excellency, the Minister of Health. Like, are you with us, Dr. Ahmed?
I am still with you, yes, yes.
تعبناك معنا اليوم. The question is, how did the Ministry of Health in Oman have ensured that once the vaccine is available, that all these steps that we have mentioned will be taken? And also, do we have certain regulations for people who will refuse vaccination?
Very important question. I'll start with the last point. I do have faith and trust in healthcare professionals to be actually the leaders in this, to lead by example. And you remember during H1N1, I was the first person to receive the vaccine in Oman, even though some people doubted that. They thought I was given an injection of water, which was not the case, I can tell you. So Zahid mentioned lots of things to do, but I think if we just go back and look at measles worldwide, in Oman, luckily, we had outbreaks, but we went mass vaccination and we managed to go back on track. But there are now people dying of measles unnecessarily because of the refusal of vaccine. So I think we need to make the picture very clear to the public that these vaccines, they do save life. As you've mentioned safety, that they are safe. And in Oman, let me make it very clear, not only vaccines, we do not import, and I'm sorry to say, but we import more than 97%, 93% of our medication. We do not import any medical product before it is licensed in the original countries through the regulatory bodies and either FDA or the European equivalent. So we go through the steps that must ensure the safety and the efficacy of these agents. And then we are very proud in Oman also. I think it was either 2016 or 2017. Between 127 countries, Oman was #1 in the program of vaccination. Not the how many people we vaccinate, but the way we manage our vaccines. So I can assure the public, I can assure all of you that my team, whom I trust and thank a lot, they are always taking the necessary steps and they are doing the right thing to make sure that we are getting the right vaccine, the right medication, and also managing them properly.
Thank you very much. Thank you, Your Excellency. Yes, yeah. Go ahead.
I'm sorry, I lost to them. So as I said, just we have very appropriate and well-known steps, whether it's medication, vaccines, or diagnostic. And start with, we always deal with companies that are well-established. We always get the approval from the regulatory agencies in these countries. FDA and the European equivalent are our gold standard. Then also when they get to Oman, they are managed properly. And I don't know whether the voice was lost when I said Oman was rated #1 in the management of vaccine cold chains in 2016 amongst 125 or 27 nations, the WHO program. So yes, we are taking the right step. But again, I urge everybody, and I urge you, the healthcare providers and professionals, to basically spread the Dr. Zahid said, and he's right, we need to publish numbers. When I say, and I'm confident and sure of it, that the vaccination rate in Oman is more than 98%, I think that itself should be a very clear message to everybody that these vaccines are safe, they are effective, and alhamdulillah, in Oman, we can afford them. For the new vaccines, we need to work harder. We need to definitely make the public aware of the minor side effects, which are not very common, but very much highlighted, unfortunately. And we need to lead by example, as I said. I think even for the seasonal influenza vaccine, I know some of my colleagues in the healthcare profession, they are either doubtful or they think, well, I'm not going to have it. But please remember, as a healthcare provider, that you have other people's life in your hand. Protecting yourself will protect your patients, will protect your family. So I'm urging everybody and all of you, even the flu vaccine, please take it. It will be available next month. That will reduce the burden in our healthcare facilities, which are already unfortunately becoming tired, exhausted. And Dr. Faryal and your team, I know you're doing an excellent job, but it's been non-stop for 7 months now. And we are all human. You are there with your shield, with your PPE, which I'm glad WHO talking about PPE and the availability almost in all their conferences, which some countries are not sharing, unfortunately, what they produce. So we are tired and exhausted. The vaccine plus the other steps I've mentioned are the only way. And if there is refusal, I think in Oman, and Sheikh Ghehlan will be definitely our advocate and partner, and he's always been very supportive. And spiritual and religious intervention in these fields are always very positive and helpful. And we'll work together, but let us get the vaccine first. Let us get the appropriate vaccine, which we are working very hard towards buying it. Unfortunately, we don't produce any of this high-tech stuff, but we definitely book with all the major companies which are in the front line with for the clinical trials. So again, thank you very much for the opportunity. And I'm sorry I have another meeting, which I thought your meeting would be an hour. I'm in Salalah, not a holiday, but a working trip. And I was meant to have a meeting at 10 o'clock, so I better go and start.
Thank you very much, Your Excellency. As usual, you highlighted a very important points, and you have made a good closure to our meeting. So I will we just thank you and thank all the speakers, the audience for being here. And I'll just leave the forum for Mr. Ahmed Al-Adawi so he can put the final remarks, inshallah.
On behalf of His Royal Excellence, Sayyid Dr. Fahad Al-Said, Assistant Mufti Sheikh Dr. Kahlan Al-Kharousi, eminent members of NBC under the leadership of Dr. Ahmed Al-Busaidi, who has been very vital in the success of this forum. So we really convey our greatest thanks to the speakers who have really enlightened us on this very fruitful night, hoping that all what we have had today was enlightening, increasing our knowledge, and it will be put into practice. So on behalf of National Bioethics Committee and the Organizing Committee, we thank you all for your sparing time attending this webinar, and wishing you good night. Thank you very much.
Thank you very much.
Thank you.
Thank you all.
Bye-bye. Thank you. Thank you.
Wassalama.
Have a good day and a weekend. Thank you.
Thank you very much. Bye.
شكرا جزيلا.
Bye-bye.
Excellent.